Our case today is basically a 65-year-old gentleman with an established history of cirrhosis for 10 years, who has been referred for further evaluation for new onset jaundice. So basically, this is a common scenario, especially in patients with known chronic liver disease, and the workup is basic. It starts with blood work and also scans, and this is what our patient had exactly. Imaging showed an 8 centimeter tumor in the left side of the liver, and the tumor showed the characteristic imaging pattern of hepatocellular carcinoma, which is basically hypervascularity on the arterial phase and rapid washout in the venous phase. So this brings up a very common question when it comes to hepatocellular carcinoma patients, which is when do we need a biopsy to establish the diagnosis? So in patients with established cirrhosis with those typical tumor characteristics, the American Association for Study of Liver Disease, AASLD guidelines, typically does not recommend a biopsy for those patients because of the risk of complications in patients with cirrhosis in terms of bleeding, for example. Our patient stage is stage 1 because this patient has only one tumor with no vascular invasion, and also scans showed no evidence of any metastatic disease. So any tumor of any size, if it is a single tumor with no invasion of vasculature and imaging and no metastasis, would be classified as stage 1. The dilemma here is the concomitant liver disease, specifically cirrhosis. So those patients are not candidates for surgical resection because of the advanced cirrhosis, which would have been curative. The next best option for patients with cirrhosis in terms of being curative is liver transplant. However, this patient does not fall within transplant criteria. The typical transplant criteria are called Milan criteria, and they specify one tumor up to 5 centimeters in diameter, 3 tumors up to 3 centimeters in diameter with no vascular invasion on imaging or metastasis. So clearly this patient doesn't fall under transplant criteria. So since this patient is not a candidate for surgical resection or liver transplant, typically treatment goal here is palliative. So unless we get our patients to a point where transplant or surgical options could come back to the table, the treatment goal remains palliative. And prognosis as well here would be dependent on the course of the therapy in terms of response to therapy. However, prognosis is poor with no curative options available for our patient.